All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So I have kept Doug's comment over here. Doug, I saw Roman saying that as well, and you are saying it as well. So Robert Malone. Okay, so good news on the guest side. We will have Professor Eli Schwartz with us. He is just figuring out the time. Hopefully next week we'll have him with us to talk about his ivermectin study. So I am pretty pumped about that. We would reach out to Dr. Robert Malone. Let me actually send a message to my EA right now so she can start following up. So tell me this, I was also planning to bring in Steve Kirsch on as well. What do you think? Okay, so Columbia Bean, yes, and Roman was saying that as well. Doug says, do we get tea? Absolutely. Doug, when we would start meeting, I would actually not only float tea, but we'll have dinners and lunch together. Roman, we Cool Bean have a guest request. Got it. So I took down the request, and we would reach out to Dr. Robert Malone and do some more discussions. Absolutely, will do. Yes. So Nancy says, hit the like button. That is the most important thing to do. Okay. So let's have a discussion. Tell me this. So there was a question in the previous talk where folks were saying that, is this a study in response to Dr. Brian Bridle? Sorry, my apologies. I am not sure he was referring to this study, but this is not a study after. This was a study before. Now, if he was referring to this study, then his conjecture is not correct. But if he was referring to some other study to have this discussion, then he may have been correct, but we need to still figure it out. The study about the spike proteins ending up in the blood, we have done that discussion. I saw somebody's comment here as well. We have done that discussion. Those authors of that study were not even sure yet on that conjecture, that is it correct or not. They said, we have a hypothesis, we can prove some parts of it if there is a special way of cutting the DNA that would end up splicing the anchoring part, if there is an anchoring part, and if that gets connected to the cell, and if that anchoring part is lost and the cell starts secreting spike protein, then the spike protein can go into the blood and cause a lot of damage. That is what their thought is. I don't think that they're so in one way, this is good that they put that thought out, that seed out, to say more data to be collected about this. Good. It is the general media and people's reaction to it, because I think we are all on edge. So we keep looking at scary things and say, this is scary, this is going to kill us now. So because of that, it became a media cycle. So if we look at that study has a conjecture. Even authors called it in the comments as the version 1 of the preprint. So that I don't think that we need to give a lot of attention to that yet until we learn more. And I would also say it this way as well, that yes, for example, for ivermectin, I say no more studies needed, we're good. And you can say, well, over here you say no more studies needed, over there you say we need more studies. Here we have a lot of proofs in a lot of studies. Plus, from a mechanism point of view, it works. What they are presenting from a mechanism point of view doesn't work. And remember, we talked about it in detail, that how many provisions and faults in the immune system have to be created to allow a spike protein to end up in the blood, and then to connect with the ACE2 of the endothelium, and then to cause damage there instead of just circulating or going somewhere else. So that is why that needs to be proved a little more. Secondly, that still is a hypothesis. There should be some more studies. This is not a hypothesis of ivermectin. There are many, many good studies. We'll have Professor Eli Schwartz with us as well to discuss that. Then no MTB says, we know LNP wasn't intact with messenger RNA in organs. No. So the number one, the LNP that they injected That LNP didn't have the virus's messenger RNA. They had an equal luciferase was the messenger RNA in there. Number one. Number two, the lipid nanoparticle, when it goes into the cells, it is broken down. So the LNP was not observed. It was the pieces of LNP that were differently tagged. These were observed in different ratios in various cells. If the LNP was intact as a whole particle, then the ratio of the 135 and 159 would be equal in all. Wherever it goes, both will go together because they're part of that ball. But we saw that 50% was already removed of 159. That is broken off of the particle and thrown out. So the particle is not intact. The remaining 1% is going out, for example, for the other piece. That means 99% sits in and 50% of the piece is already destroyed. So that is like you take a ball and then you pinch off 50% of one piece of ball and throw it out. The ball is not intact anymore. Nurse study to publish soon, it found spike in blood. So that is an interesting one. The nurses, the healthcare workers, that there is a, I'm hearing that there is a study that showed that there were spike proteins. I am really, really interested in looking at that, Doug. The curiosity that I have. So this one, I had a curiosity from a year, that what happens to the parts of the lipid nanoparticle. Similarly, I actually have this curiosity that in healthy people, when spike protein enters bloodstream, where does it go? Because for it to just catch onto an ACE2 is very difficult. This is like a river that is flowing fast. And inside the river, we have a spike protein. So if I can very quickly show how our body keeps our blood vessels pristine and clear of any issues, is the following. What happens is the endothelium, and again, these are the things that can be seen and read, not super researchy type. They are just normal. So the endothelium is very, very slippery. And not only it is slippery, it has, imagine, if you go to if you look at stagnant water, you would see a lot of those slippery fungi and those things stuck to the surfaces. Our endothelial surfaces are kept very, very pristine and slippery. Imagine just the mucous membrane of our epithelium makes this surface so slippery. Endothelium is very slippery. So that is one. Why is it slippery? Because we don't want anything to attach here. Secondly, the blood flow through the system is fast as well. And that also prevents things from just getting stuck. And when they get stuck, we get in trouble. So now imagine if a tiny spike protein is running in this blood. What will it do? Will it really connect with an ACE2? This is a mechanical problem. It's not a chemical problem. It may have attraction to it chemically, electromagnetically, but can it actually just connect with it? Because if we have to catch cells on the endothelium, we have to, just like a plane that is run away, and when the plane tries to land on the runway, we kind of put nets. And give me 1 second. I want to open the door for Luffy. He wants to go to the other side. 1 second. He already opened the door. Luffy has become quite an expert for opening the doors. So on the runway, we put these kind of anchors and we allow the plane to pass through this and get stuck in it. And that is how we stop. Or the planes that are on the Navy ships, they have those little ropes that we use to pull them back. Similarly, when we want a cell in an inflammatory place, so let's say there is some damage here, and we want neutrophils and macrophages and B cells or T cells or monocytes to enter here, we raise hooks on the endothelium. Those hooks would work with the cells, and the cells have complementary hooks, and these are called cell adhesion molecules or CAMs. Those CAM are opened up to capture the cell and then allow them to come in, and the cell would be captured. Then cells would drill a hole here and then through that hole they would enter the tissue. Spike protein has no cell adhesion molecule on it. It is just a little fish running around in the blood. What would happen? Will it connect with ACE2? Will it get a chance to get stuck here? Would it connect to ACE2 where the blood is stagnant, for example, let's say legs, or when we are sitting and the blood is circulating less in our legs? What would really happen? I have that curiosity as well, that if you put, so look, Novavax will have spike proteins on it. That is an injection of spike proteins. What will happen if those enter the blood? Would they start causing endothelial damage? So that is a question for me too, Doug. Sorry I spoke so much for this comment of yours. Genesis says, make sure you have a yellow card for Steve. Okay, so tell me more. So can you imagine this? Today I got an email from my vaccination site, and they said, download your vaccination complete report, and if you don't download it now and you want it in the future, there is all this bureaucracy. And that was just such a weird feeling to say, I need to now keep that report that I'm vaccinated. Pitbull Sleuth says, anyone over 40 in the UK are being refused any vaccine other than AstraZeneca. Anyone under 40 is being told not to take it. Nobody here wants it anymore, increasing evidence of deaths. And I was one of the earlier ones that started making noise about it. And in that process, I still remember the names of the cool beans. They were cool beans for the whole year who beat me up so much that I still have their comments and their emails and their anger. And they said, somehow I am against India because AstraZeneca is being manufactured there, and I do not like UK, or I do not like Oxford. And so there was just so much that happened. But I was correct on this one, that we should have had a protocol. So good if they're doing this. Genesis says, even Steve Kirsch is referring to the study, the lipid nano in the ovary. So particles in the ovary, and that even 0.1% is nothing. Hey, Luffy, what are you doing? He ran away. He knows now he's needed. So not interesting. Roman says, Steve Kirsch also, but keep him on a you speak then when spoken to, so he doesn't interrupt you. He tends to do that. Okay, got it. Jack says Dr. Gidon as well. Okay, let me write down his name too. Actually, I'm gonna just comment to Melissa, Dr. Gidon as well. Romana Balkova says, I was always wondering about one thing. Why use messenger RNA instead just the spike protein subunit and let the immune system react to it? They have their own pros and cons. Now with this water becoming muddied with the idea of spike protein going in the endothelial system and causing damage there, I think Novavax is going to develop some hesitancy. But here is, again, I cannot tell why Novavax decided to do subunit, why messenger RNA tried to do that. I mean, there are some business aspects as well, technology aspects as well, companies' own thesis of what they are pursuing as well. But generally, if I look at it from a, let me just start a new one. From a production point of view, if you make messenger RNA, you can really very quickly make changes to that, and then you can inject it into the cell, and the cell would make the protein. And so the normal behaviors of the cell will be engaged, of making the protein and then breaking it down and presenting it on the surface. That all is something that cells are used to doing. So you are really using a cell's normal natural behavior with the messenger RNA. On the other hand, if you have injected the spike protein like Novavax, then the question is, we are not using the cell's machinery, but we want this to be picked up by macrophages and other. And in my opinion, that is fine too, because this is what virus does as well. Virus arrives in us with lots of spike proteins on it, and our immune system responds to it and works with it. So what if the spike proteins are going to arrive in our muscle? I think that with this continuous hammering, that somehow spike proteins would end up here and end up there and cause lots of damage. And that may be true. These news are going to cause some issues for Novavax, which is spike protein. So people are going to say, well, you're going to inject spike protein in me when everybody is saying that spike protein is going to cause harm. And in this one, I think that we should acknowledge that there are vaccine-caused long-haul patients as well. And that is, I think, because of the spike proteins. I am very curious about the inactivated virus. I would think that inactivated virus would cause long haul as well, because it also has all the components that cause the immune system to become mad and go in a long haul state. So it is not that one type over the other would be better, but long haul state, I think one of my family members have become vaccine long hauler. Good news is ivermectin and famotidine and fluvoxamine, they are very, very good for vaccine long hauling as well. So Mary Antoinette, so she is for a few days. So last week she was very good, no issues. She's very active as well, and she does lots of animation work too. So she was totally happy in herself. This week, for a few days, she has been very, very sleepy, tired, fatigued. And with that, I think it is because of the vaccine. She does not want to acknowledge that, and I can understand none of us will. Vaccine or the infection and then becoming long hauler, no one would want to have that. I have patients who just the idea of having something that could be there for a long time scares them to really bad thoughts. So today then I had an argument with her, a positive argument, not a fighting match, but an argument that she does not want to take ivermectin. And her reason for not taking ivermectin is not because she doesn't like ivermectin. The ivermectin available is 3 milligram tablets, and these are 4 tablets she has to take at one time. So she says, these are too many tablets, I don't want to take them. So, but I have convinced her to start taking ivermectin, and I'll get her fluvoxamine and other famotidine as well. So adenovirus-based jabs, that is Johnson & Johnson, that is AstraZeneca, that is CanSino, that is Sputnik, they have a problem. Doug says one at a time. Doug, are you talking about the medicines? So this is a very good question. Morphin1 says, how long would AstraZeneca provide immunity? Lifelong? Ideally, yes. Original infection or the vaccine would offer lifelong. And so somebody sent me a message. She is a nurse practitioner. And just before this lecture, she sent this message. This is what is the issue. So I'm not going to read the whole of it, but one part of it is she says that she had infection a year ago. Her doctor is actually convinced that she does not need vaccine. So he says, no need, you're fine. So I love that doctor. But she says, wherever else I go, people continue to say that somehow vaccine-generated immunity is going to be superior to the infection generated immunity. And I actually had a couple of people here on the videos as well who really fought with me with, I don't know, tooth and nail, and they were so angry at me that I say that they are equal. And they were citing, so anyways, to the point that I had to finally block them. I still believe the same thing, that if a person's body has taken care of the virus and came out healthy, then what is the concept of making it better for the future by giving a vaccine, and how? And she said that some doctors, not her doctor, which is good news, says that vaccine generated immunity will be forever and infection generated immunity is not forever. The cool beans here know my rant, that, or my answer to that. If the vaccine have been targeting the original virus, and if the original infection is not permanent in protection because the virus has changed, then it's going to beat the vaccine as well. And when you say that, you meaning folks who argue on this, doctors included, when they say, well, there are adjuvants, those adjuvants are going to irritate the immune system enough that it would create more robust immunity. What is that more robust immunity? More T cells? The original infections creates a lot of T cells. It beats the body into submission to the point of death. Original infection causes a lot of B cells. It reprograms the innate arm as well. Person came out of it successfully. What else do you want that person to learn? Their immune system. So the only time when my arguments will become useless or will not get weight anymore will be when the virus has changed so much that current vaccines and current infection and protection is useless. Then people would come in and say, now what do you think about the original infection? And I'll have to concede that now the virus has changed. So that is SARS-CoV-3. William Goff says, do you think that the mechanism of action for how myocarditis could be happening is these spikes or lipid nanoparticle making its way up the coronary artery of the aorta to feed muscle spikes or lipid particles? So I actually thought about that today. Very good question. So spikes are not there so far, at least by this biodistribution discussion that we read. Some other studies saying spikes. The one that we studied before, that is also not proving that spikes are in the blood. But if we talk about the lipid nanoparticle species, then they are found in the heart muscle as well. They're found in the ovary as well. They're found in the liver as well. They're found here as well. My very simple way to think about it is the following. If in the muscle, we don't see much damage with the 80% of it, other than some hurt here and then it disappears, then why would it do anything more in liver or heart or somewhere else? One. Two, if it is going to affect heart or liver or ovary or other places, then it's going to affect here as well. Then it's going to cause antibodies in the whole body and cause many more issues, including the tissues where it goes. So that could be a vaccine long hauling state. But that would be by antibodies, not by the lipid nanoparticles. So I do not believe that polyethylene glycol, it's a lipid particle. Lipid, our body can handle very well. We handle cholesterol as well. The problem with the lipid is, for example, cholesterol. How does cholesterol end up damaging us? Cholesterol continues to accumulate under the blood vessel surfaces. And it starts accumulating when we are, it used to be said that 9 years old. Nowadays, they're saying that 2 to 3 years old babies start having cholesterol accumulating under the blood vessels. So let's go with a traditional 9 years old. And then there are doctors as well that just say this whole theory is wrong. So I'm going to go with the textbook theory so that I don't have to argue. In the textbooks, we say from the year 9 years of age, the cholesterol starts accumulating in the blood vessels underneath their surfaces, and that causes local inflammation. It continues to accumulate there, and then somewhere when we are 50, 60 over, depending upon how fast a person is eating, how much eating, how fast bad things eating, then there can be inflammation, and that would cause the coronary issues and so on. So it takes 50 years of continuously introducing lipids under the blood vessel surfaces. So if you give zero 0.5 milliliter of the vaccine, which has micrograms of the lipid particles, and then the microgram lipid particles piece is going out in the blood or tissue, it's not going to do anything. Okay, so Drbeen says, my Dr. Marty Makkari also said COVID recovered should get one shot of vaccine. Why is this still being recommended for COVID recovered? So no, I don't recommend it. That's what I'm talking about. That I don't think there is a need. Singing good music says, I wonder if we'll have a fourth stimulus check later. If we end up in SARS-CoV-3, then we'll have to have more stimulus checks. Anonymous good, is levocitirizine better than normal cetirizine? Normally levos, or those molecule mirrors that we use, are usually used for certain bio availability to be better in certain tissues or certain places. I do not know if this is exactly I do not know about levocitirizine. I'll have to look it up. Sue says, fully vaccinated cruise passengers too positive for COVID. I have done this discussion many times, Sue. Being positive for COVID doesn't mean much. Here is why. And this is with vaccine, with infection. If it is used as vaccine is better, then that is incorrect. If it is used as infection is better than the vaccine, that is also incorrect. Look, in a person, so let's say we make a nose, lips, here is more lips, and then this area, throat area, and the mouth area, and the nose area, and they are connected. We have done this discussion that vaccinated or infected, there is no possibility to stop a virus from landing in here. Correct? And the viruses that are becoming more and more faster, for example, Delta, faster, let's say 8 times, they are going to infect the cell faster. That is what we mean. It's not that their spread is faster, they're just infecting the cell faster. And that means in a shorter period of time within the throat area, they become more in number, that the person starts shedding them as well. And yet the symptom have not really fully started. So let's say the virus, we are vaccinated or infected, and the virus came in and the virus entered the cell, and the cell started making more viruses, and the viruses are now coming out and then going to the next cell, and then they continue to do these things. If this is happening, and the question is, will it happen? Yes, the answer is yes. Why would this happen? Because the immune system cannot just stop a virus as it arrives. Immune system has to wake up and work. There is one exception to this statement that I just made. If the person is in an active infection or just soon after the active infection, and they are making actively IgA, and IgA has coated the whole nasopharyngeal area's mucous membranes, then when the new virus comes in, it would be coated by IgA, and that IgA would kind of neutralize it from entering into the cells or hinder it, and the virus won't be able to do a lot of damage before it is cleaned out. But let's say IgA is not in sufficient amounts, the virus is going to get into the cell, then it is going to continue. How long? 24 to 48 hours for the immune system to wake up and respond and clear it out. Within 24 to 48 hours, or even slightly after that as well, if you take a swab of this person's mucous membranes in the nasopharyngeal area, you are going to get positive COVID. The person might even get symptoms. Why? Because virus is causing damage. Vaccine or infection does not tell the virus that, hey, don't cause any damage to the cells anymore. There's nobody standing guard there unless there is IgA present. There are going to be some T cell, B cell. So that is how our immune system responds faster. Instead of 5 to 17 days, it responds within 1 day. But during that 1 or 2 days time frame, if virus has caused enough destruction, person would even get the symptoms. This is not an escape. This is, CDC calls it breakthrough, which I think is not the right term as well. But anyways, they can call whatever they want. This is not an escape. This is not a defeat of the immune system. This is not a defeat of infection. This is not a defeat of vaccine. This is just normal behavior of the immune system. Now, is it possible that some people would actually not be able to stop it and it would end up even killing them? Yes. And we are seeing that cases, very tiny number, but yes, it can. In majority of the people, asymptomatically, it would come and go. We would not even know. Accidentally, if you take nasal swab, let's say if you start taking nasal swab from me every week, and I am exposed going out and meeting and I'm vaccinated, it is entirely possible that someday you would find a positive RNA in my throat. Some people would develop mild symptoms as well. For example, one of my friends who is vaccinated, his wife got COVID and he became sick for about 10, 12 hours. And then he became okay and he was vaccinated. And then some people die as well. My brothers, my friends, my class fellow's mother, fully vaccinated, got infected. Even after use of ivermectin, she did not make it. So majority will be protected asymptomatically, but can be positive if you check them. France says, no, Doug, there's no admin in chat. We should probably have if there are folks who are just bothering. Daniru says, sir, since thymosin alpha 1 stimulates and increases the number of CD4 cells, can't we take a thymosin jab prior to vaccine so when spikes are presented via my C cells are ready for hugs and kisses? So the can we take it? So the problem is that just stimulating the CD4 cells is not going to be sufficient. We have to have them proliferate. So first of all, we need to have the natural killer cell process the antigen and then present it on its surface. That takes days, at least 8 to 10 hours, and then even more days. For a macrophage or a dendritic cell to pick up a virus, kill it, process it, break it down, present it on MSC, and show it. Then connecting with other cells take time as well. So it's not just here, if you pour some chemical, it would do faster. If these cells are already trained, then you can wake them up faster by various interleukins. Good question, though. Learn more says I blocked the spammer. Is there some spammer? I can block them. Is that Daniru? Daniru, don't spam like this, man. I am looking at your. You filled up the whole thread with the questions. Not fair. Okay, so Swinging Good Music says people can buy fake vaccine cards online to let them into places. Roman says, if this vax was like Tdap booster I would take it in a heartbeat. Just worries me and makes me hesitant, not anti-vaxxer at all, and up to date on all my other vaccines. And Roman, I understand that. It scared me a lot as well when I went for it. Although I got it, but I was quite nervous. I was nervous for what it can do. And I was same way nervous for my wife, for my children. Although we all went through it, my wife is still stuck with it, with the bad outcomes. So I don't blame you. At the same time, just please stay safe. continue to take other things that are going to protect you. So Daniru, I have responded to your question. So please stop spamming. All right. So Bilal from New Jersey. Dr. Mobeen, if the spike protein is only part of the virus, why it's causing inflammation? Beautiful question. Love it. So answer is actually very simple. Anything that would be foreign and has an epitope larger than 7 peptides. Bilal, are you a doctor? I am kind of assuming you're a doctor and answering you like a doctor. 7 peptides or 7. So if this is one amino acid being a brick, let's say. So one amino acid, 2, 3, 4, 5, 6, 7. For example, I believe spike protein has what? Many hundreds or thousands of amino acids. So these make bases, these bases make epitopes or peptides in the epitope. 7 peptides to 22 peptides are necessary for our B cells or T cell to recognize something as foreign and then start reacting to it. So it doesn't matter if it is a small part of this virus, although it is not a small part. Doesn't matter if it is just a part, because our immune system is going to look at that and say, I don't like it, and respond to it. A interesting question to ask will be, why does our immune system not attack our epitopes? Because we are made up of cells and proteins and stuff which also has epitopes everywhere. And the answer to that is that when our B cells and T cells, especially T cells, when they're made, they're sent to a school in thymus. Inside there, we present them our patterns, and everybody has different pattern. That is why our organs are not very simply transplantable, or our blood is not very simply transfusible. Everyone is unique, and we train our immune system and we test them and say, what do you think about this pattern? So let's say here is a pattern. And this is the pattern of my body cells. We present it to the T cell and say, what do you think about this? And if the T cell tries to kill it, we kill the T cell. So I made a cartoon 6-7 years ago that T cell is all nervous going into the thymus because it knows it might actually end up being killed. Some T cell will escape the school. They will be rogue. They would not actually respond correctly, but still come out. They will produce autoimmune diseases, one of the mechanisms. So this is called self-tolerance or energy. Self-tolerance is that our immune system tolerates us or becomes energetic to us. It can become energetic to other pathogens as well, and we can become carrier. So for example, some hepatitis viruses, it just says, I don't care for you guys. And now we are carriers of, some of us become carrier to that. So I hope that answers that question. Good question. Thurj is here. Thurj, thank you very much. So the benefits outweigh the harm. Thinking about the vax induces myocarditis in young people in your side. So we talked about this before as well. They still do not have the right answer for this. I feel sometimes they're just not interested in getting the answer. And somebody outside would do some research and provide the answer. Just like in case of clotting, there were German researchers who came back and said, here is possibly what can happen. There were lots of heat with that as well, because then there was some political thing between UK and Germany. Similarly, for the inflammatory outcome, did you see that CDC said that next week they're going to have a meeting to talk about the inflammatory cardiac inflammation and decide what to do next? And it was hilarious that somebody tweeted that news about CDC having a meeting, and underneath the Twitter had said, this is fake news and see why vaccines are are safe. So they are calling CDC now a fake news producer because they're talking about vaccines may not be safe. So that is how brainless the social media censoring systems have become. Anyways, so Thurj, back to your question. Benefits outweigh the harm. That is a discussion I have tried to avoid. If you take it, benefit outweigh the harm, that is correct, because the infection can actually cause a lot of damage. And the percentage of damage with infection is more than the vaccine. I just wish that they have a better protocol for administering the vaccine. Just like somebody said, in UK now they're not giving AstraZeneca or adenovirus-based vaccine under 40. That is a protocol. We should have done these things as we saw these problems. ET says Delta is the Indian, right? Yes. So 6172 originated in India. Yes. Okay. So S. Hamid says, what is Delta variant and is it more lethal than the Indian variant? It is the Indian variant's 617.2 variation. It is more contagious. I have yet to read the Mahara's or UK's health agency's report that it is more contagious, 8 times more contagious. If it is more contagious and infectious, then it would start causing damage very, very quickly. Immune system does not become sharper with it. So, for example, let's say, I'm going to give an extreme example. Let's say here is a person got infected. It looks like he's looking on the other side. Let's make him look towards us. Got infected and now has immune system that is ready and trained. Then came the Delta, which is really fast. Now, immune system to wake up is going to take 24 to 48 hours. But if this guy is very fast and is going to start causing damage within 10 hours of monumental proportions, then this person would have a lots of issue before the immune system wakes up. Again, this is not truly an escape from the mechanism of the immune system, but it still is an escape because virus has tricked the immune system or defeated the immune system by being fast. William Goff says, do you think the US will start seeing a spike again like the UK is now with the Indian variant? So I want to see this spike because I still believe that a faster version has to allow less lethal outcome. So Worldometer UK. Yeah, it is going up. Question is, look at this. So 8,000. It was almost 2,000. So it is 4 times, right? So how was the progress here? When it was at 2,000, so September 4, 2000. Now let's see, when did they become 8,000? About here, September 25. So September 4 to 25, 21 days. Here, it went from 2000. Let's take any of these. 2000. Let's say this, May 5th to 8,000, June 10. So that is a month and 10 days. Here is also 2000, but 2400-ish on May 23. Here is 2000, May 17 to June 10. So 13 days and 23 days. So it is not as rampant. And and there is a reason for that. Here, a lot of older folks may have gotten stuck with it. Here, the population that is exposed now is vaccinated population, possibly less older folks exposed to this. They're either careful or they're at home, or unfortunately they've gotten it before. And so it really is a population dynamic is different. Virus has tried to become fast as well. So virus is trying that, hey, the population now left, I need to be fast with them, and let's see if it can succeed. I think it will not. I think we'll see some more uh, small wave, and then it would go away. But as usual, media is saying that it is going to be like this. It is going to be really bad. So we'll see. If I'm wrong, which I don't want to be wrong in this case, I don't want people to be hurt. If I'm wrong, then William, yes, this can happen in the US as well. Sunshine Bean says older population are double vaccinated, a lot of younger under 50s. And hopefully, youngers under 50s, even when this virus might actually get them into a hospital by very quickly destroying a lot of their tissue, they still have a better propensity to come out healthy and defeat the virus. So the virus is going to become less lethal. It will have to become less lethal, or it would have to slow down. Alfred says, well, Delta variant killed a lot of people in India, so I would not say it's less lethal in general. Vaccination helps. Look at the population. So we can say you're correct in saying it is not less lethal. The question is it more lethal? So Robin says, pardon me, it is spelled luciferase. It is mentioned in the study. I understand it's bio. Is this a separate discussion going on? Bioluminescent for seeing where the parts of the nanoparticle end up. Is that in the vaccine generally? The luciferase, no. They used luciferase to be able to tag it. So John Snyder says UK cases are going up. Reports are if they had one shot and Delta produces very mild symptoms, spreading it faster. Actually, spreading faster. So one thing I did not see here is the death. Spreading faster is fine. That would allow the herd immunity to develop. The question is this: is it causing deaths? If it starts causing deaths with the same proportion as before other variants, or more, then we have a problem, because now it's going to zip through the system faster. But if it is zipping through the system faster, generally it is supposed to cause less deaths from a theoretical mechanistic point of view. So let's say over here let's say this is the time that this new variant is infecting. Let's say May 24th. So we are now in June 11. So 24 to end of May, 1 week, 11, almost 3 weeks. If there are going to be any deaths because of this more than normal, we are going to start seeing those percentages start appearing here. And again, I pray that I don't. So it's not that I'm trying to dismiss it. I would wish that this don't happen. There are no deaths. Fine. It can zip through the system as long as it doesn't kill the people. Doug says Scarlett has a question. Let's see. Scarlett. 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 Scarlett, can you type your question once more, please? I'm trying to see it. Can anyone echo Scarlett's question? Scarlett, I'll look again. I can't see it yet. Denazir says, what are your thoughts about mixing AstraZeneca vaccine and a messenger RNA vaccine? So I actually believe, and we talked about the study in which mixing them probably produced more intense side effects the next time, but the immunity was good. So if the mixture is that, hey, we took AstraZeneca, but now we learned a lesson, we should not ask women under 50 years of age to take adenovirus-based vaccine, give them messenger RNA or some other, I think it would be messenger RNA, I would welcome that. That would protect people. Grant says, how do you know if you have internal organ tissue damage from COVID? Some things you can know, some things you won't. For example, lung damage, there are signs, right? So breathlessness with exercise and so on, that can be seen. Immune system dysregulation, the long hauling states, we know those as well. Some things you cannot know right away. For example, diabetes might develop early because a lot of pieces of pancreas are damaged, but beta cells are still making enough insulin that we don't feel we are diabetic. But now the remaining beta cells would be destroyed early because they are just getting destroyed as we live our life. So then the person would develop diabetes earlier. So there are some issues that would pop up right away, and then some would appear in the future. So I'm going to once again see if I can find Scarlett's question. No, I can't find it. So Pulkit says, given a choice, you would take AstraZeneca or covaxin. I think covaxin is the inactivated virus, correct? So as much as I like inactivated virus, if you give me this guarantee that inactivated virus is truly inactive virus, then I would take inactivated virus over the adenovirus. Serge, thank you very much. Roman says, the advice of some of the doctors is beyond stupid and nobody can be held responsible. So I totally agree with you. Here is the thing, an area where I think there is, so for example, did SARS-CoV-2 come out from a lab? We can't do much about this. We, the lay people, maybe the countries have to get together and talk with China and make sure this doesn't happen again, if this happened. At this time, we know that there are certain risks of vaccines. So a person who was infected and recovered, why to push them towards a vaccine? Why do you have to do that? Yes, a person who is not infected and has a chance of getting infected and probably dying or becoming a long hauler, fine, vaccine seems fine. A person who has recovered, why to push them there? So I'm just strengthening or reflecting with your point. Similarly, under 50 years of age, women, why to give them adenovirus? Or messenger RNA-based viruses under 30 years of age, young children who may develop cardiac inflammation, either don't give them or decide how to protect them. So you're correct that some of the messages coming from doctors are, I was thinking about that today because some folks continue to message me about various situations, and this when she messaged me, I was thinking it is not only that they believe that you should just go take a vaccine, it is also because they don't learn. So it is a result of them not learning. So the CME system and CE system and doctors' training of learning to be a learner, that all is just not working. So as Hamid said, is it true COVID genetic material, COVID or SARS-CoV-2? COVID is a disease, not the virus, right? SARS-CoV-2 genetic material is 90% similar to MERS, but 50% less deadlier than MERS. I don't know about that. I know that it is they are 86% similar. But if it was less deadlier than MERS, I don't know that. So I know there are similarities, but I do not know the fatality rates of in this context. Frisco Coupon says, do the different variants have different rates of percentages of long haulers? If all are the same and one spreads faster, does that mean lots of long haulers with this new variant? Very good question. I did not actually look up the data for long haulers. Unfortunately, UK is not very good about understanding long haul and managing it. They're actually not very good at managing this at all, other than doing a lot of experiments with the vaccine, changing the window for a good one, or now mixing the vaccines to protect women. So I think they're doing good things with vaccine, but they're not doing good things otherwise. So I do not have the data for how many long haulers with the new variant. Robin says, thank you for all your amazing work, Dr. Bean. I've been quietly watching you for a year, and I so appreciate your in-depth information and study reviews. Thank you very much. And talking about quietly watching, I want to recognize and give a shout out to Andy. She's a physiotherapist. She reached out to me and said, I've been watching you for some time as well. She said, all of your videos. And she said, I can help you with your hand. And yesterday when I was driving back, she spoke with me during that time, and she gave me some advice even during the driving. And the advice, just this much of an advice, that she said, try to keep your palms up so that your humerus is outward rotated as much as possible during the drive. That within 10-15 minutes, my tension in the trapezius and my tension in the shoulders, that went away. And I was telling my wife, I said, she just said a few sentences of, so she talked with me about an hour for getting my history and what should be done, but she just said a couple of sentences for what to do right there, and I was almost like new. So that, thank you very much for watching, and thank you to Andy for such a wonderful advice. So EJ says, are doctors legally silenced by their employers? I don't think they're legally silenced. Of course, employers have NDA signed with them. They had contracts signed with them. Plus, it's the doctor's career as well. I think these are the kind of things that work against the voice. $22.22 says, what's going on with Novavax? Still not out there. We're still waiting. Roman says, my dad had COVID serology positive and now went away, which is natural to go away after some time. His PCP is strongly insisting on him getting the jab. Why would you advise a T1 diabetic who survived real virus to get a jab? Yes. So this is the key point here, is survived the real virus. Dude, I'm talking to the doctor. He survived the actual virus against which you're going to give the vaccine. He survived it. So stronger vaccine for what? Bilal, New Jersey, Dr. Mobeen, SARS, MERS, long haulers recovered within 12 to 24 months. Do you think it's going to be the same? Yes. So I am actually seeing many long haulers very gradually over 10, 12 months, continuously becoming better. So yes, I was actually talking with Hina, my wife, today, and I was saying, look, if you're not going to listen to me, it is going to recover. You are going to become fine. But if you listen to me, I might be able to help you accelerate to get back in your normal state. Susan says, can ivermectin raise blood platelet levels? If so, is this safe? I haven't heard of any such mechanism that it should do that. And the safety can generally be seen as, is the platelet level dangerous enough? Are there signs of clotting. So that is how, or the tests of clotting. But ivermectin is not supposed to do that. I'm still hoping. So Bob lost all faith in my doctor since I know more than he does on this. And this is the tragedy of this time, that generally the population has become cynical. And that doesn't mean they trust me and not trust somebody else. Folks, there are who trust me and then not somebody else. There are folks who don't trust me. So the whole population, in one way or the other, has become, has seen how inefficient, incompetent, indifferent the medical system can be. And I had made this comment once before, I'll say it again. Some of us who were exceptions, for example, they had cancers or they had liver failures or they had exceptions from compared to the regular diseases, they were suffering this kind of a behavior even before. But they were just so few and so much on the less in the general mainstream that medical system was doing the same to them and they were not taken care of. Now the medical system is doing it to all of us. And now we figure out that how bad it is. We became exception. All of us became an exception, and medical system just behaved as they do. So M. Gregory says, why do some people feel they have the right to force vaccine on others? This is, I'm sure it is a rhetorical question. I have I'll go on a rant if I started answering that question. ET says, curious if this drug coming out that is similar to ivermectin but remixed and patented by Big Pharma could draw in the vaccine EUA, since there would be a treatment. Yeah, so look, if they can come out and they can get that declared a treatment, they can get $1.2 billion purchase order. If they can get it declared a treatment as well, then who cares for the vaccine? Now they have a treatment. So, and that one company would say, we are happy, we are earning. I think you're talking about Molnupiravir from Merck. Art Patron Forever says, based on numerous adverse reaction events, should the vaccination be a 3-dose course having low threshold? First dose, should a 100-pound woman receive? I agree with you. I like this, what you're talking about. Or increase the gap like UK did. So yes, you're correct. There is Cyber Nurse question. Hi, Dr. Bean. Thank you for the super chat. I arrived late this evening, but I'm interested in knowing if you talked about post-vaccine long hauler this eve. Thank you for all you teach. Much love. Thank you very much. Love back to you as well. Yes, I did talk about it, that I think it is important to recognize that there are post-vaccine long haulers as well. Our medical system is already not recognizing the infection outcome of the long haul, and we have vaccine long haul outcome as well. We need to get ahead of this fast. So yes, this is an issue. So here is a good news. We were exchanging emails with Dr. Paul Marek. We were talking about the long haul protocol that I led and would be on FLCCC soon. And good news is, from a mechanism point of view, the same protocol is going to work for vaccine long haul as well. And so I think there is a help to accelerate the recovery, but there is no help yet to ask the authorities to be a little more wise about how to administer vaccines and the decisions and the protocols around that. I was actually thinking yesterday, day before yesterday, in last few days, that we used to be very proud that, hey, Americans are free. And here we are stuck with this medical system that has taken away all kinds of freedoms. Question by underscore. Do you know of studies addressing reduction in transmission and contraction of COVID? Not only symptoms and viral load reduction. I see a lot of misunderstanding at this. So let's see. Studies. So addressing reduction in transmission and contraction of COVID as a result of what? Not only symptoms and viral load, as a result of vaccine or the infection or just in general? Good question. Vaccine-based studies, I've seen one from Pfizer from Israel of reduced transmission. Of course, we know that the reduced contraction is there, yes. Symptom and viral load, yeah. So there are studies of vaccines. Are you talking about vaccine or variant or infection or post-infection? David says, Dr. Mobeen, please, how my endothelium health could attenuate COVID-19 symptoms severity and COVID-19 symptom duration. So look, let's go to an ideal state. If your endothelium is in an ideal state with your immune system in an optimal state, then the COVID cannot get into the blood vessels, cannot, even if it is there, it cannot bind to ACE2 and cause inflammatory dysregulation. This is in theory. Problem is this. We still do not know why some folks respond with a cytokine storm. We know the damage that occurs, which includes the endothelial damage, but we do not know that. So many people say this is an endothelial disease. Agreed, lots of endothelial damage. Is it the endothelial damage that causes the cytokine storm? If that is the case, what allows the virus to go cause the damage, and why does this not happen in everyone? So just like allergies, 20% of the people get allergies and the remaining 80% don't respond to those things. Similarly, this virus has this weird behavior that in some people, 3% it would kill, 5% in the ICU, 20% in the hospital. So it has that allergic type behavior, but what is the underlying mechanism? What genetic issues, or we know obese folks, diabetics, hypertensive, or the cardiovascular compromised, immune compromised, cancer patients. We know the categories of people. We do not know what underlying mechanism is causing the problem so that we can go and fix it. And so really there is not a good answer to what you're saying. We can all be in healthy state, but is that a guarantee? And talking about this, I had ample time while driving, 11 hours on the way in and then 10 hours or 9.5 hours yesterday coming back. And I was thinking that for 15 months now, we made a tiny caravan and we just kept going. And fortunately, I think those who were directly in the cool bean structure where we were doing those prophylaxis and being sane and doing social distancing, meaning we were not, I'm going to do the prophylaxis, but I'm not going to do mask. And I think we ended up protected, at least so far. So we marched through a very difficult time, and here we are. So there are ways to protect, but I do not know exactly what causes the virus to go bad. Rosie says low vitamin D is the answer. That is correct. But Rosie, even with low vitamin D, we know that there is a percentage that dies. For example, in the studies that we talked about, good vitamin D still ended up with 1% death compared to 6 or 7% death in the community they were testing. So vitamin D is an important question, very important question and answer, but it still is not sufficient. Abdullah Musa says, I had mixed vaccine, as you know, 14 weeks apart and didn't have side effects other than an arm pain. Do you think this is because I had longer gap as German study, no side effect after 10 to 12? No, so some people actually just don't have the side effects. In my own family, both time I got Moderna jab, I felt I would freeze and I would just become sleepy. So you can watch my videos in those days and you would know. But second time I had it lesser than the first time. First time for 2 weeks, my jaw I could not move. I do not know how I taught in those days, or talked, or ate. Now, my son, who is allergic, who used to have not anaphylaxis but would develop hives all over his body, he had no side effect at all. My other son, who is now has allergies, who didn't have allergies before, now has allergies, he had no side effect at all. My wife, who has always beaten viruses, I would get sick, she would not. And she always used to say that, hey man, my immunity, look, I am here and you are. And she is, I think, experiencing long haul with vaccine. So it's not necessary that you have to have side effects to see that your immune system is working. Alfred Chow says, my opinion of horse ivermectin. Horses can cost millions and they probably have better quality of medicine than humans. I would still not comment on it, Alfred. So Pitbull says, yes, they're refusing to give me an alternative to Oxford, that is AstraZeneca. So now I'm without a second dose because they refuse to mix, but I think one shot is good enough. So the one shot's efficacy after 84 days in UK studies had shown the efficacy to go up to 80%. Two shot, 84 and above, even to 90 and so. So there is a reduction in efficacy. Maybe it would continue to go up. I do not have data for that, but they should give you an alternative. Mike Weedley says, Dr. Bean is cool, don't get me wrong. Mike, did you just say me something that now you are kind of saying, I still love him, but I'm going to say, Mike says, this guy's cool, just saying. Thank you very much. So Bignati Brooks says, what do you think about the theory of heart inflammation being a result of poor administration of the vaccination and it's accidentally being injected into the blood vessels? I did a complete video about this in which I talked about what will happen with the vaccine in the blood vessels. So vaccine in the blood vessel, one, it is very difficult for it to go there in the blood vessel because deltoid is chosen because of its thickness and because of the blood vessel that is here being very, very tiny and small and next to the bone. That means, could I claim that this would never happen? No, there could be somebody who can accidentally damage the blood vessel and inject near it, and then some of it goes in the blood. But generally, this is not related to entering the blood vessel. I have done a complete discussion of entering a blood vessel would mean what, and would we have enough of the damage that we can end up with poorer outcomes. Roman, you are very, very correct in this one. It's just beyond words that COVID and vax long haulers are swept under the rug, totally in another tragedy. Absolutely. So whenever somebody asks me that what is the biggest problem, so yes, we have millions of deaths, just US 600,000. So that is a huge, huge tragedy. And then in addition to that, an unacknowledged tragedy is the long hauling. Long hauling, a person then, when somebody sends me this message that I am suffering of the long haul and my employer does not agree with me and they think I just have psychological issues, it really breaks my heart, because taking away somebody's well-being or making somebody scared about their financial state because if the employer is not going to agree, then they would take their lower performance or need to stay home or need to take off or not being able to concentrate or focus as bad performance, and that would impact their career. And so this is hugely devastating. We will continue to work on this. So the protocols that we're working with, I think, will have the answers, Roman. It says that these should have been coming from the leadership. Leaderships should have been scrambling to provide answers to these things. But if you go to CDC site, they simply say, we are still researching. We're still trying to find out. The situation is still evolving. We do not know more. If they do not know more, then, hey, man, why are you stopping us from ivermectin? How do you know more then? So anyways, now I'm going to stop myself from a rant. Grand Celebration says, I've heard it described as the new medical tyranny. Yeah, it is. So big pharmas, healthcare organizations like CDCs, FDAs, over there it is big pharma is greed, CDC, FDA is corruption, doctors is ignorance, incompetence, and indifference. So it is different kind of disease for different groups of the system. So Mbal, Fachi was too busy talking, doing talk shows. I cracked up when he was saying, I am, if you deny me, you're denying science. I am science. That was just, France says rants are healthy. Yes, but I have so many folks, I don't want to waste your time by doing these rants. Sometimes I become really upset. Genesis says, is the efficacy of natural antibody created from surviving a SARS-CoV-2 infection be reduced when you take prophylaxis? No. So I am assuming that you're saying prophylaxis with ivermectin. So no, and ideally once you have recovered, you don't need the prophylaxis anymore, and as well, but taking it doesn't hurt. I take it. I have vaccine. No. So I have done many times this discussion. You can probably look for my video, will ivermectin block a vaccine? And in there, the mechanism is the same as infection as well. Frisco says, do you think the underlying issue for long haulers is more likely something those people are born with or something that happened to them post being born? Don't know. I keep thinking about it. So is it, for example, there are some diseases in which one hit or one genetic change is something that a person is born with, and then they get another genetic change afterwards. I think retinoblastoma is such an example, where some X-ray or light or something else caused one more mutation in the nearby gene, and now a full-blown disease occurs. So I don't know if it is that. We don't have that data yet. I wish I knew. So Carolyn, so she only takes it when I insist, and then she starts giving a gap. So I was today upset because I have a family member. I know I can help her, and she does not listen to me. So I was saying that you got to take it, and she said there are 4 pills. I don't want to take 4 pills. And second thing she said was, I have taken it before when you said, and I felt no difference. But the problem is she has not taken it on a more regular basis. So I requested her once again. I said, look, you will become okay, but we can help accelerate the recovery. So she said, okay. So I'm gonna have to now personally present it to her every week, or I'm going to try it more than that in the beginning. Thank you for asking. Roman says, thank you for the super chat. I wish there were more doctors like you, Dr. Corey, Dr. McCullough, Dr. Yo, Dr. Patterson, Tyson, Jalali, Heather, and Tonatos. You're 1% battling against the 99% of users, doctors who just follow orders. Yes, thank you very much for this. And yes, I have so many of the doctor. Of course, my whole life is medicine, teaching medicine. So my students are doctors, my students are nurses, nurse practitioners, physician assistants, residents, doctors. My colleagues are doctors, my class fellows are doctors. So I am in the pool of doctors. So I think you are too. I think you, Roman, you are a physician. And it's just so disappointing. When they start smirking, as soon as you say there are ways to protect the patient, or when they start doubting with their expressions when you talk about long haulers and things like ivermectin, it is just, it is sad for the patient. Sunshine Bean says, at what stage would budesonide inhaler be used upon positive test respiratory symptom? Would any steroid inhaler work, or does it have to be budesonide? So the testing was done on budesonide. The recent study in UK was also on budesonide, 800 microgram actuation, 2 actuations per day. So because it was done on that, ideally it should be budesonide, but others could be as well because they are steroids, but the penetration, bioavailability, molecule structure, formulation can matter. The UK study had given administered budesonide when the patient came into outpatient. So that means they already had infection and they started developing symptoms to the point that they had to come into the clinic and say, I have a problem. So I would suspect 4 or 5 days after the start of the infection. I know doctors in India, Pakistan, Middle East, and other countries that use it early on from the day one. I even know doctors that start dexamethasone on the day one. It scares me, but they do it and they say we are fine with this and we protect our patient. But from my study point of view, there is one study that showed that steroids can reduce the clearance of coronaviruses. So should be 5-6 days later, or if you see that the oxygen is dropping very fast, then immediately start it. Tech ads are. Thank you very much. Thank you for your dedication educating the public. Thank you very much, and thank you for the super chat. Denise says, you'd be surprised how many more docs I'm finding who are listening and not smirking. That is actually excellent. So there is a momentum that is building. Serge says, if to assume that the virus is man-made, can then be it so that it can not exist for a long time? So the qualities of this virus, the difference from its cousins, the vastness of the features it has, the damages it causes, then the depth of damage, then the durability of the damage is something that is out of ordinary. So to answer your question, let's say if it was man-made, cannot exist for a long time, then ideally it should have been made to exist for a long time. But the human body and then human race, excuse me, our resilience is underestimated. Humans do not just lie down, roll over, and be just killed like this. We are killed at this time, but I think we will bounce back. Our immune systems would help us. Things like ivermectins and hydroxys and social distancing, wisdom, just wisdom would help us as well. We'll get out of it. Roman has to say, okay, so Patricia says, been taking ivermectin fourth week. Doctor at FSC told me it is as good as taking the vaccine. Is that true? You are the best, and your graphics are great. So Patricia, thank you very much for liking the graphics. I spend a lot of time making it. The as good as the vaccine, there are certain goods and bads in both. Ivermectin doesn't have the adverse effects possible as vaccines have. So there ivermectin is good. Vaccines taken once, and if the healthy outcome, then you don't need to actually continue to take vaccines, hopefully. Ivermectin, you would have to continue for some time. So they both have their own pros and cons. They both have, they don't, either of them don't have 100% efficacy. So that means it is possible to have ivermectin and get sick. It is also possible to have vaccine and get sick. So probably combining them both, that's what I did for myself. So I always try not to ask others to do it. So I give my example. I did it, my family did it. So that is what I believe in. It is so funny. Someone was asking yesterday's talk, I believe, yesterday's talk or a few days ago, there was a talk that I did which was not very pro vaccine. And so I was surprised to see that somebody said, did I miss what doctor said, in a comment? And underneath somebody else said, no, you didn't miss anything. He's just being covertly pro vaccine. So what? Sir Fred says, would it make sense for someone with vax long hauler side effects to first shot of AstraZeneca to choose mRNA for second dose, keep on the same type, or none at all? Depends upon what is the state of the long hauling. I would have said that first see why the long hauling occurred and try to manage that and see if you can manage it. If the long hauling is not getting managed, then the second shot can actually make it worst. So I would first focus on that. And if you're worried about the protection, you can get the antibody test done and see how protected are you. MJ Carroll says, Dr. Bean, are there any studies showing a correlation between long haulers and their blood types? Also side effects of vaccine and blood types. So no studies for the blood type. There is study for blood type O to say severity is lesser in them, but that is not so much to say everybody O is protected. But long hauler side is not. So that's an interesting point of view though. Also side effects in the vaccine and blood types. So infection and O is less severe for infection, but that would not be the case with the vaccine, because O is more protected when it becomes a cytokine storm and clotting occurs. So if vaccine does not cause clotting, then this would not happen. If it does cause clotting, then blood group O is better protected. Sigrid says, please consider my question. Sorry, let's see. Sigrid, I don't see it. Can you type it again? Swinging good music says, and Luffy will help us get out of it. Do you know what Luffy did today? So I'm so upset about Luffy. So since I came back, he's been just hanging out with me. I was painting yesterday, last night, and he came and sat down with me and continued to munch at my painting pen. So I would be doing this, and he would just munch at it. And then today, this chair that I'm sitting in, I sit here and prepare for these talks. And when I was with my colleague, she had chairs that were wooden. So they were beautiful chairs, but wooden. And so it really disturbed my back. So I bought a small throw, which is soft, and I used that for the last discussion. And then I brought it with me. So I had that throw in this chair, I still have it. And Luffy came and slept on it. He just loved it. So I started preparing, and I just sat with Luffy, and he didn't like it. He got down and it stood there, and he would just keep looking at me. So I was having my meeting with my executive assistant, and I was using webcam, not this one. So I trained the webcam to Luffy, and I said, Melissa, do you see what he's doing? And she said, yeah, he looks very upset. And I said, look what would happen. And I got up. And as soon as I got up, Luffy dashed and sat in the chair. So then I let him have the chair till 4 o'clock. And I stood up the whole day. My desk can go up and down. So I had to stand the whole day because Luffy would not give me the chair back. And I tried to put the throw on the other thing over here, and he would not sit there. He wants to have the throw on this chair in this corner, and then he would sit. So that was just, I'm so upset with Luffy. Sue says he smells the other cats, possibly. Yes. So there were two cats over there. Mike says, I've had the stupidest wax conversations with people. I hate it. Okay, so Sigrid says, effect of ivermectin on myocarditis. Okay, so good question. Let's assume for myocarditis, what is the reason? So I'm going to draw. This is a good one. This may actually need to be taken out of this video and separately shown. Look, let's say this is a cardiac heart cell, right? So heart cells have these branches in them. This is a heart cell. And the myocarditis can be, or the inflammation, most possible reason is probably that when the virus arrives or the vaccine, so let's say vaccine here, spike protein. So when the vaccine arrives and we make antibody against some part of this spike protein, that one part can bind with the cardiac cell as well. So that is sort of a mimicry. One possibility, we do not know the mechanism. This would be mimicry, and that if that happens, when the antibody would settle here, that would cause local inflammation, that would cause inflammation. So myocarditis, pericarditis can occur. Other possibility is vaccine, and this is not possible, but I'm going to consider this to be a possibility as well until proven otherwise. So let's say the vaccine generated spike protein binds with the spike protein itself, and that immune complex comes and settles down. So here is the spike protein, and here is the vaccine bound to it. And this immune complex now settle down on the cardiac tissue. If this happens, this would cause local inflammation as well. Although this is not possible because having a vaccine and spike protein, having an antibody and spike protein complex enter the blood system, then go around and settle in the heart is going to be very, very rare. It's almost impossible. But this is a possibility of creating inflammation here. Two. Third is that again, not really possible, but let's entertain this. This is ACE2 on the cardiac tissue, and the vaccine generated spike protein is just running around, as some people think. I do not agree and believe in it. And then it connects here with the ACE2 and causes local inflammation. 3. 4. Somewhere else in the body is a fight going on where there is this spike protein is pieces are presented on the surface, and the immune system is responding, and the cytokines are being produced, and those cytokines are in the whole body. They're going around in that process. They are in the heart as well, and maybe they cause any other cells here are activated and inflammation can occur. That is another possibility. So antibody based damage, this is the most probable mechanism. This is easy to happen. And it happens with viruses all the time, that we can develop myocarditis. Coxsackie virus is such a virus that does it. So this is possible. This is less possible. This is even more less possible. Now, if I go back to your question, can ivermectin help? So look, ivermectin would help if, let's assume it is this mechanism. Let's name them. Let's say mechanism 1, mechanism 2, mechanism 3. If it is this mechanism 1, then the ivermectin can help reduce inflammation, but other anti-inflammatory would help as well. So not much help. If it is 2, it will be helpful because it can bind with the antibody. If it is 3, imagine that this number 1 is happening also because of 3, because this fight is causing antibodies to be produced. And those antibodies that are being produced are now going and attacking here. Then having ivermectin can really help reduce that behavior. Ivermectin goes into the cell as well. So if a spike protein is produced by a vaccine inside the cell, ivermectin can kind of hinder it there too. So because of that, ivermectin has actually a good chance of protecting here as well. If I was the one, instead of just using ivermectin, I would actually start using immune suppressants, because we don't want to end up with a patient having inflammation of heart. So I would give something stronger than ivermectin. Good question. Doug says still the UK graph. Doug, I didn't get your question. A UK graph. We looked at it, this one. Or did I not share my screen? Okay, so let's see some more questions. T. Way says, question, can you share the dosage of ivermectin you and your family take prophylactically? I take 12 milligram per week. My wife, as you can tell, she does not like to take it, and so whenever I insist, she takes it. But 12 milligram, that is with our weight. So my weight, I think, is near 70. So I am in 0.15 to 0.2 milligram per kilogram range that I'm taking. I haven't taken 0.3 or 0.4. I think my wife needs to take 0.3 or 0.4. My family member who developed anosmia, she was 62, she was diabetic. I was very scared for her that she would end up in a hospital. To her, I had given 0. And she developed anosmia as well. To her, I had given 0.4 milligram per kilogram body weight for a week, and she became, the second day her anosmia finished, and then I asked her to continue taking it for a week. Then when I tried to start steroids for her, thinking if she has the COVID, I want to get ahead of the cytokine storm, she just refused it. She said that, hey, with ivermectin, I'm fine. Why should I take this? So that was amusing for me, that the patient refused other drugs because they felt so well, although they should have taken it. Sunshine Bean says, if myocarditis is side effect is an autoimmune reaction, would this mean that people with autoimmune conditions are more susceptible to it? No. So autoimmunity, yes, the immune system is slightly more upticked, and so any immune response can be more. But this is not exactly an autoimmune, although it can be the the first mechanism can become autoimmune. But no, just like to give you an example, folks who have autoimmune disorders, they do not get all kinds of inflammation to run away. They have a specific target because the immunity is targeted at some parts or nuclei or epitopes. So Skyfrog says, if a person stops ivermectin, Skyfrog, you have this plane as well in your picture, and you say Skyfrog as well. So do you fly? So if a person stops ivermectin prophylaxis for say 3 weeks, okay, does the loading dose day 1, 3 need to be repeated? So in the studies, they would just repeat this 1 and 3 every month. So from that point of view, yes, I would just say as soon as you get it, take 1, 3 and then take it weekly instead of 3 weeks gap. But yes, to your question. So this JLB, you're correct that if we end up, so look how tragic is this, that when we get COVID, we are told to wait at home, which actually means we are told to let it reach a point that they cannot then handle it. And then if we end up in a hospital, it becomes bad. Vic Stivala says, did you have, if you're hospitalized, I would still think that they're giving steroids and they're giving anticoagulants and hopefully ivermectins and famotidine and fluvoxamine and antihistamines, cyproheptadines. So that's how they would handle it, should handle it. Vic Stivala says, any potential long-term side effects of taking ivermectin for a period of time prophylactically? So not known yet. I have been taking it for a long time and no side effects. So it has never been used like this on weekly basis for so long. So we'll see, but I don't think there'll be side effects because it is pretty safe. It is safe because of its dynamics and its kinetics. Also, in terms of early COVID-19 treatment, pros and cons of ivermectin cocktail versus monoclonal antibody infusion. I would love polyclonal or this Regeneron. Regeneron, every time I've seen it given, majority of the time it just wins. So instead of monoclonal, if polyclonal, and please remember, at least in the US, you can request for Regeneron. Regeneron is approved or authorized by FDA. So if you go to a hospital and you want Regeneron and they are not aware of it or not going to give it to you, you simply say, I need Regeneron. And they would ask you to make the request and they will give it to you because it is authorized. Ideally, they should give it to you. It can be asked on demand. So in terms of early COVID treatment, pros and cons of ivermectin cocktail versus monoclonal, I would combine them both. But if monoclonal, I would want to have polyclonal. Other than the inconvenience of infusion, and infusion has not been very successful anyways. So monoclonal, if that is the only choice, yes, I would continue to give ivermectin with that. But let's say somebody is in a hospital and they're not going to give ivermectin, then monoclonal is for sure. Polyclonal would be even better. And long-term effect with antibody infusion, not much. 3-4 weeks and antibodies degrade and go away. I'm very allergic to many things. Carry EpiPen, which would be safer for me. Thanks. You're fabulous and cool. Thank you very much. So, of course, continue to take vitamin D, hydroxy, zinc, or quercetin, zinc with ivermectin if possibly you can. And monoclonal, even if you are allergic, monoclonal are coming from somebody else. Usually they have, monoclonal is not coming from somebody else. These are actually chimeric antibodies. That means they're made in mouse and then taken the pieces and replaced with human antibodies, which may be from somebody else. So monoclonals are safe therapies. They should be okay with allergies too. Ivermectin should be okay as well. I think they should be combined. And so you'll be fine with the monoclonal. Scarlett is here. Scarlett, I'm so sorry I could not find your question at that time. Is ivermectin prophylaxis still 0.4 milligram per kilogram, and can you take it when you have the inactivated vaccine? Do all viruses work as on a spike protein? So first, if you're in the area of outbreak, then 0.3 to 0.4 milligram per kilogram. Otherwise, I still give prophylaxis at 0.2 milligram per kilogram weekly. But folks who are India, Pakistan, areas, Nepal, 0.4, 0.3, 0.4. Now, do all COVID viruses work on a spike protein? Do you mean all coronaviruses? Are you saying that do all coronaviruses have a spike protein? Yes. Do they all have this kind of a spike protein? No, they bind to other things. This is just a crazy one. Alan says, do I detect a cough? Well, guess what? Chlorine dioxide kills 90% of all maladies. Thank you very much. So Luffy was sitting here the whole day, so I'm allergic to his hair. Okay, so Doug, I removed the UK graph. All right, so how about we break for now? I wanted to make sure that I had taken a day off, so I spent some more time with us. I was actually, yes, Luffy Dander, you're correct, France. I was actually planning that this weekend I'll just go on for 10, 20 hours. But the work that I did, I'm very, very grateful that she is now stable. I was telling my wife that she was not in a good state when I picked her up. And then within 2 days, the last day when I came in, she was standing up, walking around, talking with the caregiver to say, we should do this, we should do this. So that, imagine just having one person improve is how rewarding. And then doctors, if they do a good job with their sincere job with their patient, how much rewarding that can be and how important that is. So with this, thank you very much. Have a good day. Like, subscribe, and share. Have a nice weekend as well. Do me a favor, like for sure. And in addition to that, if you want to support this work, there are 3 links. Buy me a coffee, or you have a PayPal link as well, or you can be a patron too. So thank you very much, and I would see you on Monday. Please stay safe and healthy. I want to do a Zoom call again as well. So if there are folks up for Zoom call, let's do that next week. Thank you, and bye-bye.